This video will cover anemia of inflammation, formerly known as anemia of chronic disease, which may lead to disorders of marrow production. To anchor ourselves, let's look at this fish that looks a lot like a character named Nemo from a certain movie. This fish holding the torch will remind us that this video covers anemia of inflammation, because anemia sounds like Nemo, and inflammation is represented by the lit torch. It looks like those EPA agents are not very happy. They might want to shut down whatever operation is going on here. These agents are placed here to remind us that decreased erythropoietin and decreased sensitivity to erythropoietin are the mechanisms of this disease. Since erythropoietin is often referred to as EPO, and EPO is so close to EPA, that's what we'll use to remember this. Moving on to the TV. You see the channel? That channel sounds a lot like MCV, right? And the fact that there's a big smiley face on the TV represents normal MCV. See how this scene is taking place in a hospital? This represents the fact that anemia of inflammation is the most common cause of anemia in hospitalized patients. The cancer awareness ribbon on the wall represents malignancies, which commonly lead to anemia of inflammation. The rent-a-toy stand represents rheumatoid arthritis, since rent-a-toy sounds like rheumatoid. Bats are blood-sucking animals, right? The blood-sucking bat holding that tin can full of food represents ferritin, because tin can sounds like ferritin, and because ferritin is a protein found in blood. Additionally, since the can is full, it will remind us that these patients commonly have high ferritin levels. There is a caveat, however. Ferritin is an acute phase reactant, and therefore ferritin levels must be interpreted with caution in patients who are in an acute inflammatory state. Ferritin is also a good way to distinguish between anemia of inflammation and iron deficiency anemia, which normally would show low ferritin levels. Let's take a second look at these EPA agents. Their physique looks fairly average, right? These agents not being super muscular and not being super thin either is a representation of normal SSTR levels. SSTR is the short way of saying somatostatin receptor, and SSTR sounds like the word strength if you were to shorten it, right? So in our scenario here, if the agents were very muscular, we'd say that SSTR would be high, and vice versa. The last point on this is that iron deficiency anemia, on the other hand, will likely show high SSTR levels. You see the shark plushie on the ground? It represents TIBC, or total iron binding capacity, because shark in Spanish is tiburon, and tiburon, when shortened, can kind of sound like TIBC, right? TIBC in these individuals is likely to be normal or low, which is why the shark looks sad and is on the ground. This trampoline represents transferrin saturation, because trampoline sounds like transferrin, and the static electricity on the trampoline sounds like saturation, static and saturation. But there's one more thing. You have to be more than 15 years old to use it, and that represents that transferrin saturation is expected to be more than 15% in these patients. Lastly, look at the sad, lonely tick. It's sad and lonely because it represents low reticulocytes.